sore throat, fever, and respiratory symptoms, which can be severe. Flu is most common in winter months, when many people can get sick at once, an epidemic. When is flu season? Flu season, when cases of flu go up dramatically, is October through May. The highest number of cases peak, usually happen between December and February. How common is the flu? The flu is one of the most common infectious diseases. Every flu season, about 20 to 40 million people in the world catch the flu. What is the difference between the flu and the common cold? The flu and the common cold can have similar symptoms, like runny nose and cough. But cold symptoms are usually mild, and flu symptoms can be severe and lead to serious complications. Different viruses cause colds and the flu. How do I know if I have the flu or COVID-19? Since they have similar symptoms, the only way to know for sure if you have the flu or COVID-19 is to get tested. They both have a risk of serious illness, but different viruses cause these infections, and providers treat them with different medications. Who is at higher risk for complications from the flu? Certain health conditions can put you at higher risk for severe illness from the flu. This includes life-threatening complications that require hospitalization. You're at higher risk for serious illness if you have asthma, COPD, or another chronic lung disease, have a history of kidney, liver, neurological, heart, or blood vessel disease, including stroke, have a condition that causes issues with muscle function or makes it difficult to cough, swallow, or clear fluids from your airways, have diabetes, have a weakened immune system from HIV/AIDS, cancer, or immunosuppressive medications, have a blood disorder like sickle cell disease, have a BMI greater than 30, have obesity, are under 5 years old or over 65 years old, are pregnant, are under 19 years old and take aspirin regularly, live in a long-term care facility. Symptoms and causes. With so many symptoms in common, it can be hard to tell the difference between a cold and the flu. Here's how to tell which is which. What are the symptoms of the flu? Symptoms of the flu usually come on quickly and can include fever, chills, body aches, cough, headache, sore throat, runny or stuffy nose, congestion, tiredness or feeling run down, diarrhea or vomiting, usually only in kids. You may not have all of these symptoms. What causes the flu? The influenza virus causes flu. Influenza A, B, and C are the most common types that infect people. Influenza A and B are seasonal. Most people get them in the winter and have more severe symptoms. Influenza C doesn't cause severe symptoms, and it's not seasonal. The number of cases stays about the same throughout the year. H1N1, swine flu, and bird flu are both subtypes of influenza A. Is the flu contagious? Yes, the flu is contagious. It spreads from person to person. For every person infected, they spread the flu to 1 to 2 more people. How does the flu spread? The influenza virus spreads from direct or indirect contact with someone else who's infected. Common ways to get the flu include from someone nearby coughing, sneezing, or talking. Droplets can either get onto your hands or move through the air to get into your nose or mouth. The flu then moves into your lungs. By touching a surface that's contaminated by the flu virus, then touching your face, nose, mouth, or eyes. This includes things like doorknobs, desks, computers, and phones. By touching the hands or face of someone who has the flu, then touching your face, nose, mouth, or eyes. Thank you for watching my video. Like, share, subscribe to the channel for more videos.